everyone, my name is Paige. I'm going to be your technician getting you started with your aligners today. This is my patient Jess. We're going to be starting her aligner journey with Heinz Ortho today. So I have a few things that I'm going to show you so that you can be prepared for your next visit. We have a few things that we're going to use for your visit today. In order to put our attachments on, we like to make sure that your teeth are extremely clean. So what we're going to do to start is we are going to polish your teeth like when you would go to the dentist, just to make sure. And then we are also going to be using some cheek retractors. These are going to keep your cheeks off your teeth for us. And then what I'll be able to do is keep everything nice and dry. As I prep your teeth with the first jelly that we will be using, which cleans your teeth even better, it is a green etch solution here. I'm going to be rinsing that off, drying your teeth again, and then we'll use this stuff. It's called Assure. It's like a sticky vitamin for your tooth, and it helps to get those attachments to stick. All right, Jess, so in order to start your aligners today, we are going to be adding some things called attachments to your teeth. These are going to help the aligners track with your teeth a little bit better than if we were to just use the plastic. Of course, they will be tooth colored. They're not going to be red like this. This is just so I know where they're going to go on your teeth. Not every patient has the same attachments. They'll all be a little bit different, but I'll get started on explaining how we're going to do that. All right, Jess, so to get started today, the first thing I'm going to give you is some glasses. Those are super important to keep your patients protected during this process. And then the next thing we're going to be doing is polishing your teeth. All right, so I'm going to go ahead and get polishing. So what I'm going to do is just quick give you a little polish. Get some more. Once I have her polished, I'm gonna give her a nice little rinse, and then we'll get started. Go ahead and close. All right, so we're gonna add some cheek retractors into the equation now. So I'm gonna pop these in nice and gentle for our patient and make sure she's nice and comfy before starting with anything else. How do those feel? Good. Good. All right, so I'm gonna start by drying off the teeth. So I'm just gonna gently dry. And then I'm gonna start painting on that green jelly to that tooth. And we're gonna let that set for about 15 seconds. Once it's set, I'm gonna be quick just rinsing this off because we are just demonstrating today. So just a nice little rinse. And then once I have all that etch rinse off, you'll notice that the tooth starts to become a little bit frosty as I start to dry it off. And then we're going to be adding some Assure to make it nice and sticky for that attachment to go on. And we're gonna dry one more time before we're able to add our template in there. And all you're gonna do is line it up right with her teeth. And we're just gonna push that right on there. And then we are able to cure. And we cure each attachment for about 20 seconds. All right, so now that we have all of Jess's attachments on, we are going to be cleaning up any extra glue that was left over from the templates. We're gonna be using a slow speed handpiece today with just a composite burr. Doesn't damage your tooth at all, and it just vibrates and makes some noise as I use it. So all we're gonna do is we are just going to push my little foot pedal here, and then I'll be able to get rid of any excess glue that might be on her tooth. All right, so now that we have Jess's attachments on, and they're all cleaned up, there's no extra glue on her teeth, we're just gonna make sure her contacts are open with some floss. Make sure there's no glue anywhere it shouldn't be. Once we know we're good, we can try in the first set of aligners. So this is number one. All we're gonna do is kind of just like the template, we're gonna line it right up with her teeth, and we'll be able to push it all the way on here. And we're just gonna gently work our finger pressure around, and that's how we'll ask you to do it yourself. Same thing on the bottom. Gonna line it right up and push it right on there and make sure everything fits really nicely. Certain people's aligners can be a little bit trickier than others to put in depending on how much crowding you have. So the easiest way to get them in when you start is to line them up with the 4 front teeth first, and then adding that pressure to those 4 front teeth and then gently working your way back. Just like that. Some patients need rubber bands with their aligners, so Dr. Heinz will have already added some buttons into your aligners, which the elastics will then hook up to. We'll talk to you about that when you come in for your first visit if that is something that applies to your treatment. All right, Jess, how did we do today?
Super good, very comfortable.
Awesome. Well, we can't wait to see you guys when you come in for your first visit. We hope this helped you get a little bit more prepared for that initial start.